Good evening, everyone. Welcome to this webinar hosted by Global Heart Foundation. What we're going to do is, while we wait for more people to join in, before we begin, we request that you watch a really short video about the organization, about the work that the foundation does. And following the video, we will go into an interview and discussion with Sujal Narayan. So requesting you to stay with us, and let's wait for more people to join in, and looking forward to seeing more of you here. So we'll quickly just go into a video.
डायसोर असताना म्हणजे जजमेंट चालू असताना मला थोडंसं हे झालं होतं, असं एकदम घाम वगैरे खूप आला आणि छातीत चौकळी झाल्यासारखी वाटली. जबान जी असते ती थोडीशी अशी बोबडी व्हायला वाटलं. त्या बाकी स्टाफ जो होता, आमच्या कोर्टाचा स्टाफ होता, त्या लोकांनी मला तिथे उचलून सरळ दवाखान्यात नेले तिथे.
I started sweating and started coughing a lot, but I didn't realize that it is an heart attack. So my left arm was numb, so my chest was burning completely, and all the acid stuff were coming from my nose and mouth. But I didn't realize that I am getting that because I was very confident that I play regularly. So
ते सहज म्हणजे थोडं दमा वगैरे लागायचं व्हायचा, घाम यायचं डोक्यातनं, ते काय होतंय म्हणून मी काही गोष्टीला आलो, मी आणि मिसेस आलो. म्हटलं चला एक चेक करून घ्यावं म्हटलं. मी त्या डॉक्टरांना भेटलो, त्यांनी एन्जिओग्राफी केली. काय एन्जिओग्राफी नंतर त्यांनी ICUमध्ये ॲडमिट पण केलं.
एन्जिओग्राफी केल्यानंतर मला त्या डॉक्टरांनी 5 ब्लॉक छातीमध्ये आहेत असं त्यांनी सांगितलं.
They were forcing my dad that there's 2 blockages, one is 80% and one is 60%. They say that we will do angioplasty on the 80% blockage and you will be okay. But I said no. So they took me back to my ward. Then the doctor came and spoke to me. He said that there are 2 blockages and we will put an we will do angioplasty on the 80% now. So I asked him why only 80, why not 60? So he said that 60 will get cured with the medicine. So I said that if 60 can get cured, why can't 80 can get cured? So he said, are you joking? It is very serious. So he got wild on me.
आणि मी जे म्हटलं का ॲडमिट का केलं म्हटलं, ते एन्जिओग्राफी नंतर सोडलं पाहिजे म्हटलं, मला घरी जायचंय. तेव्हा तुमचे एवढे ब्लॉकेज आहे, 80-90% ब्लॉकेज आहे. म्हटलं ठीक आहे, पण म्हटलं मला मुलात सल्ला घेतला नाही, कोणाला विचारलं नाही. म्हटलं मी असं झालं नाही, म्हटलं तुम्हाला एक 80 एक 90 खर्च, हे पैसे भरून टाका म्हटलं.
सर्व डॉक्टरांचं सांगणं होतं की पुढे काही होऊ शकतं. त्यानुसार की नाही मला इतका त्रास जाणवत होता ना की अक्षरशः मी देवाला प्रार्थना करत होतो की मला ह्या क्षणी तू घेऊन जा. आणि घरचं वातावरण माझं एवढं बिघडलं होतं माझ्यामुळं.
मला काय म्हटलं, आम्हाला चिरफाड करायची नाही. मग मुलांनी डिसिजन घेतलं की आम्हाला ग्लोबल हार्टच्या दवाखान्यात जायचं आहे आणि आम्ही इकडे आलो.
Global Heart Foundation is a specialist in non-invasive cardiology since 2000 and has treated thousands of patients since then in Pune, Maharashtra and all over India. The USP of Global Heart Foundation is the non-invasive diagnosis and treatment for heart ailments. 3-dimensional vasculography, a diagnostic test, ECP, external counterpulsation, a technology that was innovated in the USA, and an Indian FDA-approved purely herbal medication with no side effects, Myodrops XL, are the spearheads of the organization. ECP, the technology for external counterpulsation, is innovated in the USA and is an excellent alternative for angioplasty and bypass surgery as well as a preventive. The treatment reduces the risk of complications, does not require hospitalization, and is simple, painless, safe, with no side effects. It is a perfect alternative to surgery and is approved by cardiac professionals worldwide.
नाही ECP तर ते बेस्टच आहे, प्रश्न नाही आहे. म्हणजे पेनलेस आहे, कुठलं पेन नाही काही नाही. मी माझी जे क्लिप हे केलं होतं, मी चालू केलं होतं, ते सुद्धा मी लोकांना दाखवतो.
ज्यावेळेस मी ECP केली त्याच्याच एक 15 किंवा 20 दिवसानंतर मी स्वतःलाच एकदम हे झालं की मला आता खूप बरं वाटते.
सुरुवातीला जो त्रास झाला ते 4 पायऱ्या चढल्यानंतर एकदम सदन लागून जातं, तो आता कम्प्लीट गेला आहे. तो आता खूप दिवस सुद्धा सहज चढू शकतो. तो आता काही खूप त्रास झाला.
मला इतका आराम भेटला की मी 4थ्या मजल्यावर राहतो, दिवसातून 10 वेळा खाली 10 वेळा वर जातो, गाडी चालवतो, स्वतःचे कपडे धुतो, स्वतः सकाळी 1 तास फिरायला जातो, संध्याकाळी 1 तास फिरायला जातो. पण मला असं कधी छातीत ओढणं किंवा दम लागणे किंवा असा कधी अनुभव झाला. कार्डिओलॉजिस्टचे डॉक्टर होते, त्यांनी माझ्या हार्टची तपासणी केली, संपूर्ण चेकअप केलं. त्या सरांनी मला असं सांगितलं की तुम्हाला काळजी करण्याची काय गरज, तुम्ही कुठल्या गोळ्या खाता, तुमचा हार्ट 95% चांगला आहे.
Myodrops XL is a purely herbal medication approved by the Indian FDA. This outstanding cardiac stimulant with no side effects can be taken as a preventive as well as a treatment. Amongst many other benefits, it opens up collaterals, improves arterial elasticity, and is proved to be a perfect alternative to surgery.
बाकी दुसऱ्या कुठल्याही गोळ्या खाल्ल्या नाही, पण मी स्वतःहून आता 3 वेळा जर सांगितलं तरी 3 वेळा जातो, खाली येतो, वर येतो. आजही येऊ शकतो, काही प्रॉब्लेम म्हणजे हृदयाच्या बाबतीत एकदम क्लिअर झाला असं मला वाटतं.
Right now I do weights, everything, and it is okay. I never had a problem after that till date. So it has helped me a lot, Myodrops, and for me it has been a lifesaver.
मग एकदम ओके, काहीच त्रास नाही. आजपर्यंत मला कसलाच त्रास नाही आहे. म्हणजे आज मी 60 पायऱ्या चढू शकते, उतरू शकते, 4था मजला कुठेही जाऊ शकते. माझं वय आता सध्या 71 वर्ष चालू आहे. ह्या गोळ्यांनी खूप म्हणजे गुण आलेला आहे.
अनेक जणांचा पण असा अनुभव आहे की ग्लोबल हार्टमध्ये आयुर्वेदिकचे डॉक्टर असल्यामुळे त्यांना चिरफाड न करता, कुठल्या गोष्टीचे कापाकापी न करता मनुष्य ठीक होतोय, हे महत्त्वाचं आहे.
नाही, माझं हेच म्हणणं आहे की आता बाकी आपण जर बायपास करतो म्हटलं तर तुमचा जास्त खर्चिक भाग आहे. तो त्याच्यानंतर ऑपरेशननंतर जो तुम्हाला म्हणजे मानसिक त्रास आहे, बॉडीचा आहे, तो फिजिकल आहे, तो आहे, आणि बऱ्याचशा तुमच्या ज्या ॲक्टिव्हिटीज आहेत थोडं रिस्ट्रेट होतात त्या.
हो सर, जर बायपास करायची म्हणजे 3-3.5 लाख रुपये खर्च आहे. हो सांगितलं होतं, तिच्याकडून नाही 3-3.5 लाख रुपये खर्च येईल.
जर तुम्हाला चिरफाड करायची नसेल आणि तुम्हाला योग्य तुमचं शरीर ठेवायचं असेल तर तुम्ही ग्लोबल हार्टच्या हॉस्पिटलमध्ये या.
So we play right now almost 80 to 90 minutes total I can play. So using these medicines, Myodrops. So the another effect that I feel is that when I was before the attack or that stamina was not there. But right now I feel that I can play if I am not practicing as well.
कारण माझे पहिल्यापासून मनाची ऑपरेशन करायची तयारीच नव्हती. मी या बाबतीत विरोध होतो. मी घरच्यांना सुद्धा कल्पना दिली होती की मी ऑपरेशन करणार नाही, मी सडनली गेलो तरी चालेल, माझं कोणी दुःख मानू नका, पण मला ऑपरेशनची माझी मनापासून तयार नाही. सडनली मी ज्या ऑपरेशनमध्येच समजा गेलो तर तुम्ही काय करणार.
इथे ते नाही आहे, कमी खर्चाचं आहे आणि चांगलं आहे, आरोग्य चांगलं आहे. बाकी तुझ्या ॲक्टिव्हिटीसुद्धा सुरू होऊ शकतात. तिथे जर असला तुम्हाला बिलकुल तुम्ही कम्प्लीट तुम्ही एकदम बेडला तुम्ही बेड रिडर झालं म्हणतो आपण 1 महिना किंवा 2 महिने असं. इथं तसं काय नाही आहे, ॲक्टिव्ह चालू असतं. पण इथं कुठलं ॲडमिशन वगैरे नाही, हा प्रकार नाही आहे. दररोज येणे 1 तास ट्रीटमेंट घ्या आणि जाणे, एवढं फक्त फक्त मुक्कामी त्याची व्यवस्था नसली तर त्याच्याकरता ग्लोबल हार्ट फाउंडेशन बेस्ट राहील असं मला तरी वाटतं.
Don't wait to call a cardiac ambulance. A heart attack can happen to anyone, anywhere, anytime. You can avoid the trauma of an angioplasty and bypass surgery. To know more, call us at Global Heart Foundation.
Welcome, everyone. I hope you were able to catch most of that video, if not all. Welcome to this webinar. We are going to be speaking a little bit more about Global Heart Foundation and some of the services. My name is Sasha. I'm going to be your host today. And as we have Sujal Narayan. I'm going to introduce him a little bit before I bring him on, and then we'll ask him a few questions that will help us understand a little bit more about non-invasive cardiology. Working with Global Heart Foundation for 20 years now. He is the managing trustee of the organization. The founder, in fact, Dr. A.V. Narayan was Sujal's father. So I can imagine this project and this foundation is very close to his heart. Currently, Sujal's role at GHF is patient care management, where he personally speaks with patients to understand and help them address their needs for non-invasive treatment. Welcome, Sujal. Thank you for taking this time to speak with us and share your information and knowledge and also spread awareness about non-invasive cardiology. Welcome. Over to you.
Thank you, Sasha. Thank you to you for taking the time out. It's absolutely wonderful to try and spread the word around and let more and more patients and people know about what we're doing here. I'm always excited to do it. So thank you.
Yes, thank you, Sujal. And I think that I can speak for myself when I say that some of the work done by Global Heart Foundation is fairly unspoken. And we're not very aware of it. And I had to learn a lot through your website and conversations with you and your team as well. So just tell us a little bit, Sujal, for new members that are here, a little bit about the Global Heart Foundation, how it started, anything you'd like to share a little bit more about the purpose.
Absolutely. So first off, I definitely agree with you. The first few years, late 99 is when the founder, Dr. A.V. Narayan, sort of took this project off. It was really, really difficult in the beginning years. We faced a lot of stiff resistance from a lot of people who were opposed to the idea of non-invasive cardiology, but it's through persistence and years of hard work by my team and and of course, needless to say, by Dr. A.V. Narayan, that we finally have now made a small place for ourselves where anybody in and around the Maharashtra belt comes to us for any non-invasive cardiology needs. The idea was very, very simple. We wanted to present an avenue which is absolutely bankable, something that is proven, something that is clinically tested, and something that has a lot of results. Usually what happens is, people who have any alternative line of medication, they have a lesser range of clinically proven clinically proven documents or how the treatment goes, etc., etc. So this with ECP is a US FDA approved treatment. It's a treatment that can be taken by almost all sorts of patients.
Right.
And we just sort of, to be honest, we just sort of hit it out of the park with this one. And ECP has just fantastic results. We had patients who could who would run out of breath from the reception to the treatment room, and we would have to keep a chair for them in between. And by the time they finished the 35-day treatment, they would go walk on their own and probably start even their evening walks, morning walks. So it's like a turnaround for them.
Wonderful. And that just leads us into, Sujal, if you could share with us, for all of us who are new to this idea, right? What are some of the services and what comes under non-invasive invasive treatment? You did mention EEP, but ECP, but for those of us who are new to this concept, like, can you take us through the services, the various services that you provide?
Certainly. So very quickly, so usually any heart patient is, or actually all of us know at least one person who either has heart trouble, who either has gone through an angiography, angioplasty, or a bypass, or is currently has already gone and taking medications, or is having some sort of symptoms. I seriously doubted that there is anybody who's attending this interview, and I must thank that so many people are coming here today to watch this webinar. And it's it's like everybody knows that if there's a heart trouble, then I need to get an angiography, then I need to get an angioplasty, and then I need to get a bypass at some point in time, perhaps. Right. They're also okay with the fact that they might have to go in for a repeat angioplasty, or I know we've got patients who had 2 bypasses, 3 bypasses. I mean, it's just, I just feel exhausted listening to them about their ordeal. I cannot even imagine from where they've drawn the strength to go through that kind of situation. Yes. So ECP, EECP stands for external counter pulsation. So it's counter to your pulse. So that's the basic of it. It's a treatment. It's a OPD based treatment, and we've set it up in Pune. In fact, we were one of the first people in India to set it up. When we set up our machine, there were only 2 other machines in all of India when we started this program in late 2006. And with lots of patients' blessings and with God's grace, we now, not only ours, but people who have also entered into this stream of treatment, there are close to 3,500 installations in India now.
Wonderful.
So we have literally grown manifold.
Right.
So to quickly tell you about what ECP is, it's a treatment where there are some places, there are some treatments that we cannot treat. Like for instance, if somebody has a valve issue, or somebody has is just gone through angioplasty or a bypass, there is a contraindication that he has to wait 15 to 30 days to get this treatment. Of course, there are other contraindications like pregnant women cannot accept this treatment, and also somebody who's got severe varicose veins cannot accept this treatment. But people with, we have got a very high success ratio with varicose veins, but of course, with the other 2 things, there is no working our way around that. So ECP is a treatment. I'm going to also try and see if I can organize a very, very small 1-minute video as we're talking about it. So ECP is a treatment that the patient takes on an OPD basis. It's a 35-hour treatment, and ideally the patient has to come 1 hour every day or 3 hours every day, depending on the kind of situation and the condition that the patient is. Some patients need to spread out their treatment over 35 days, 1 hour each, and some patients can take it 3 hours a day and finish it off in about 17 to 18 days. This treatment is exceptionally effective for patients who are facing symptoms like angina. So there is a study in the US which is approved by the US FDA, written in prestigious journals, that 90%, 89.6% of the patients who took ECP felt relief from their angina in the first 9 days.
Wow.
And almost the similar number of patients did not feel the need to go in for a surgical procedure for the next 2 to 3 years after consuming this sort of a treatment.
All right. Okay.
So the ECP now, in fact, in the US, it's a treatment protocol. So the insurers have approved ECP as a line of treatment, because not only is it non-surgical, it's also affordable, because surgery is extremely expensive all across the globe. And the same in US, it's prohibitively expensive, but in India also it's not cheap, right? But this treatment across the world is comparatively much cheaper. Just to give you an idea, it is at least it's generally about 20 to 25% of an angioplasty and a bypass.
Wow.
So that's the kind of cross difference that you would get. So what a patient basically needs to do is he comes in for 1 hour, lies down on a bed, and there are blood pressure like cuffs that are strapped from his ankles, his thighs, and his buttocks. And systematically, there is a inflation of these cuffs right from your ankles, then your thighs, and then your buttocks. So what we really do is we sort of increase the blood flow to the upper torso. I mean, really, I mean, there's a whole lot more that's happening. But if I were to just simply explain it, what do we do? So we increase the blood flow to the upper torso, thereby giving more blood to your heart. And thereby, usually what happens, see, the heart it's a pump, right? The primary functionality of the heart is to take blood in and to take blood and to throw blood out. That's it, right? I mean, so simple, yet cannot do without it. So what we try to do is we work on the function of EF. It's also known as ejection fraction. We'll try to make sure on 3 grounds. So ECP is absolutely, a must do for 3 kind of situations. So one is the kind of patients who cannot go in for surgeries. There are a massive amount of patients who are inoperable.
Right.
They just cannot bear the trauma of a surgery. It could be something as simple as an angiography, because diabetes is not a contraindication to ECP, and that's a big green flag, because a lot of people who are highly diabetic find it extremely difficult. They have to go through and they are put on a massive amount of drugs before the surgery just to get their blood sugar in control. And then they have to face the effects of that after the surgery, complications. So there is
the psychological stress and all of that, right? Because there's so much stress involved in surgery as well.
Absolutely. It's just it's not. And the thing about a heart disease is it's not the patient only, it's the entire family that goes through the entire illness, because if a patient starts losing confidence, that patient slowly is walking towards his loss of will to live. And that's a very dangerous place to be. So, we can definitely take care of these kind of patients. The second, so inoperable is one. Second is the ones who want to avoid a surgery together. Like I said, we cannot treat. There are some patients who specifically need surgery. You cannot avoid that in some cases. But the silver lining here is there is a huge group of patients that we actually can deal with. So that's the point to make, that always check for your options. What happens is it's when they're in a tearing rush, everything is made out to be in a tearing rush and decisions are taken. Sometimes it's not like that. And the last category is for patients who need to get anything preventive done. Now, as time is progressing, in the last 10 years or 20 years, we've realized that this is a family lifestyle disease. The grandma, the grandfather had it, the dad had it, the mom had it, and now even the next generation or the one after that has it as well. So it is becoming hereditary in very many cases.
And it's coming up younger and younger nowadays.
Absolutely. That's reflective of the sort of patients that come to us. Not to mention that the high pressure corporate lifestyle doesn't at all. We've more and more younger patients. I mean, it's sad, but very, very rare case. But the youngest patient that we've treated is 24 years of age.
Wow.
Yeah, so as old, but as time is progressing, we have had a bulk of patients, and trust me, the 30 to 45 bracket is slowly swelling up. More and more patients are coming because they're also moving into pre-diabetes much quicker. Usually about 25 years ago, pre-diabetes was a stage of maybe 45, 50 to 60. That has moved, now pre-diabetes starts anywhere between 28 to 48, So it's changed. So that's how ECP can help. I don't know whether I can quickly do a 1-minute video. Let me just see if I can quickly do that. So sort of to back up what I'm saying over here.
Sure. Otherwise, I think in the first video that we shared as well, there was a little bit about the bed with somebody being strapped on, right? Like we did see a bit of that. Okay, so this is exactly that.
During EECP therapy, the patient lies on a treatment table with large blood pressure-like cuffs wrapped around the patient's calves, thighs, and buttocks. The EECP treatment is timed to the patient's heartbeat. While the heart is at rest, the treatment cuffs inflate in sequence from the calves to the thighs to the buttocks. Just before the next heartbeat, all the cuffs deflate at the same time. The squeezing action of the cuffs increases blood flow to the blood vessels that supply the heart muscle, increasing the amount of oxygen-rich blood being delivered to the heart. When all the cuffs deflate at the same time, the amount of work the heart has to do to pump blood out to the body is lowered due to a decrease in the resistance to blood flow. For many patients, completing 35 one-hour treatments of EECP therapy may result in the recruitment and/or enlargement of small blood vessels, known as collaterals, that can increase the blood supply to the heart muscle, decreasing their chest pain, fatigue, and shortness of breath. There is also evidence that other major organs, such as the kidneys and the brain, receive additional blood supply.
So this was a very short video to just tell you about the functionality of it. This was is taken right from the US FDA website. This is a US FDA approved treatment.
Approved treatment. Wonderful. Yes. Lovely. Okay, so that's one of the services, right? And one of the major treatment plans as provided by Global Heart. What are the other things that is provided? I know you spoke a little bit about Myro drops. So can you tell us just a little bit more about that as well?
So yes, Myro drops, absolutely close to our hearts, so to say, is been invented by Dr. A.V. Narayan. He's been awarded. He's received the President's Award, the Pride of India Award, the Shiromani Award, and countless other actually for his work in the field of herbal cardiovascular substances, that drugs that he has invented. It's absolutely incredible, the kind of results and the kind of patronage that, if I may use that word, that we've received. So Myro drops is a totally herbal drug. It's FDA approved drug. It's clinically tested for all for the satisfaction of every authority. By the way, the facility is a GMP certified, good manufacturing practices certified company, and we are in our 23rd year of operation. I have lost, with God's grace, that's one count that I'm happy to lose, but we've lost count of the number of patients that we have treated now successfully with ECP, and I'm sorry, with Myro drops.
Myro drops.
It's a herbal drug. It comes in a small bottle, as you must have just seen. It comes in a glass packaging simply because to preserve the, to keep it away from moisture and all the other things that might deteriorate the condition of the drug. And we have had patients, you must have seen in the video as well, that they have taken nothing but Myro drops and really made good of their condition, really made good out of their life. So it's supposed to be taken with a little bit of lukewarm water, and we've been having absolutely fantastic results with this. What happens is, over a period of time, there are some people who are not close to us. So like, we got the ECP treatment and our center is in Pune.
Yes.
And there are a lot of people who want to come to Pune who are not able to come to Pune.
Right.
So Myro drops is an excellent first step. It's an excellent place to, sort of test waters as well, because I totally understand that, just because I'm saying so, or just because, somebody's just organized a webinar or, they have a website, doesn't mean, so Myro drops is an absolutely great testing ground, and we've always had fantastic results thereafter. So, people have just come in, they've sort of seen that, okay, we've got a great, place to start. And after about a month of consuming the tablets, they do see a difference. And then they're like, okay, great. So, let's talk to them. Let's find out how we can get better. And then, when they do the Myro ECP combo, that's just like, it's like a double cannon, if I may use. So it's like just drives straight where the problem is. And we really have fantastic results with that.
Lovely, lovely. And also, Sujal, you were mentioning there are some ailments that ECP can't address, right? So would in those cases you also suggest Myro drops to people who have other issues that ECP can't possibly solve?
Absolutely, but see, whenever there is a valve-related issue, even even Myro is. I would personally put it on, as a secondary treatment. I cannot. The valve related, usually what happens when the patient has to go in for a valve replacement.
Yes.
That we don't have a direct cure for that, or rather we cannot try to treat that.
Right.
So, but what happens is, so the applicability for Myro drops is pretty much the same. So if I may again quickly reiterate the three groups. So one is that patients who are inoperable, so
Yes.
who cannot go in for a surgery and want some sort of a relief and
Right.
want some sort of a treatment, they can try myodrops, number one. Number two, patients who don't want to go in for surgery, myodrops again, a great starting point. If they are
Yes.
away from Pune or cannot do a 15-20 day trip to Pune, we
Yes.
usually have this whole thing organized. I forgot to mention in ECP. So we have a lot of, by the way, we have a lot of outstation patients now. About 50 to 60% of our 50% of our patients are outstation patients now.
Who come to Pune for this
Yes,
treatment.
yes.
Wonderful.
So we've got the whole staying arrangement and this and that and everything, because
Superb.
a lot of
Okay.
people come with families. So that was a very quick thing that I missed. And the third thing is that patients who are, again, for hereditary, so just like a preventive,
Yes.
I mean, just to give you an example, that just because we spoke to somebody from the Pune Marathoners Club, we organized a couple of sessions for them,
Yes.
and they asked us that, hey, you know what, we run marathons on a regular basis, so can I take myodrops as a supplement, as just as something on the side? And the
Yeah.
answer was yes, and some of them did take it.
Oh, fantastic. Yeah.
I don't have any issue, but I still take myodrops, just as a maintenance dose, because
Wonderful.
I know what goes into it, and
It's herbal.
yeah.
Yes.
So why do I want to? I'm just as much prone as the next person. Just because I'm working in this field doesn't mean that I'm not exposed to the threat of a cardiovascular disease, right?
Yes.
So I'm like, okay, maybe at a later point in time, if I have a problem, it could be a little mellowed down. So I take, once a year, I take myodrops as a preventive.
Yes, wonderful. Okay, so we do have a few more questions for you, Sujal, and there are some questions coming in from our viewers as well.
Sure,
So before we come to your answers, Bhushan has asked a question. I would just like to remind you that you have shared about myodrops and about ECP. Is there any other services that are offered by Global
So
Heart, right?
yes, another one beautiful service that we have is called as the 3D vasculography scan. Now, the 3D vasculography scan comes out in a 14-page report. It talks about varied parameters of the heart. It's not specific to, let's say, what what the blockage is, or what pumping power is, or how is it the electric function of the heart, etc., etc. It gives you a sort of an overall view of what's happening. And what we study, in fact, a very commonly misinterpreted fact is that angiography tells you the blockages.
Yes.
So that's a very highly misinterpreted fact. Usually it is due because of the lack of blood flow, the blockage is estimated.
Right.
So, it's not that you actually go and measure the blockage.
Yes.
It is how less is the blood flow. Depending on that, a cardiologist will estimate that how much is the blockage.
Right.
So in the vasculography scan as well, we measure the lack of blood flow.
Wonderful.
And that's important, because how much blood is being able to, how much heart is being able to circulate, that is important.
Yes.
Because like I said, it's a pump.
Yeah. So would you say it's a very effective diagnostic tool that could be used, that is non-invasive, because I know angiography is...
It's an absolutely excellent choice for a non-invasive diagnostic tool. There is no injection, there is no dye, no sample of blood is taken, absolutely nothing. They're just ECG-like electrodes that are placed on your chest wall. There are about 14 of them. It takes about 20 to 30 minutes where the patient has to just simply lie down and just try to have a regular pattern of breathing. That's about it. Even if he or she does not matter, the reading can still be done. And that's all we require from the patient. We do require the patient to follow some protocols, like if they are under a lot of heavy medication, then we would like to first know what sort of medication they are consuming. And also, we do not recommend an extremely heavy meal before the scan. We do not recommend that patients have a few cigarettes or something like that before the scan. So usually the best way to get a great reading of the scan is to come empty stomach.
Yes.
And also to stop the medications for that morning. That is the best ideal way. But what happens is, many times some patients cannot do without their medication, or there are some patients who are highly diabetic. They need to eat their diabetes medicine, or they need to eat something.
Yes.
So then we recommend them that, okay, you can have something light, like, maybe just a fruit, or maybe just a little bit of milk, and just maybe one or two biscuits or something, just to sort of keep them going. And then as soon as they finish their scan, and they can eat something. Usually when we do it at the center, we try to organize something for them. As you can see, this is the scan machine.
Right.
So the patient just lies down over here. That's all. The rest of the work is done by the machine. And one important thing that I missed telling you is that here there is no question of human error, because the entire computation is done by the machine.
Okay, including the readings and
Absolutely.
everything.
So there is no guesswork over here at all.
Right.
The machine is doing the entire reading, and this reading is done with an absolutely incredible technology. There's data sent and received millions of times, because then it's finally composed into one specific chart. There's a stencil that the software has, and the software puts the entire data onto that stencil, maps it out for you. So you actually get a 3-dimensional view of your heart. What's happening inside your heart, you can see it. It's a color page report. And the most important thing, so usually when you go for a blood test, you need, or any other test, you need somebody to interpret it for you, right? It's not very easily understandable. But in this case, our doctors can actually tell you what the diagram means, so that if you come back probably next time for a scan, then you can see by yourself how you've done.
Yes.
So, we are not interpreting it for you. We are not telling you how you're doing. So there is, first of all, there is no human interference. The machine does it for you, and then the patient is able. So there is a lot of empowerment that way,
Right. Wonderful. Yeah, this is so good to know, because so many people have had experiences with angiography, and the invasion at some level does cause a significant amount of stress, right? Mental stress and all of that. So it's nice to have this alternative and spread awareness about this alternative, if it is equally effective as well, right?
Right, absolutely.
Yeah. Sujal, now coming to our next question, and also similarly asked by Bhushan here, how can people who have already undergone heart surgery in the past, how can they benefit from some of your treatments? That is one, and I'll be very specific in asking Bhushan's question here. Bhushan says he has undergone angioplasty 4 times, with 4 stents and 2 balloons. How could myo drops help me? So just some answers for Sujal, for example.
Sure. So Bhushan, just just to answer your question, ECP or myodrops don't have a contraindication. I'm presuming that since you're asking me how the treatment can help, which means that you're either looking at 2 things. One is that you still have persistent symptoms, or 2 is that you're just making sure that you don't want to get into that bus again. So I'm presuming that these are your 2 perspectives of asking this question, and I'm going to answer it from that perspective. So one is, like I said, that the contraindication for both ECP and for myodrops, they're very, very limited. This is an absolutely safe to consume treatment, and this is an absolutely safe to consume drug. So which means, like I said, that there are many patients who don't have trouble, who don't have any sort of symptoms, but are still taking this. So the way you can approach us is you can call us or you can email us. We'll share our numbers one more time, or if you just search for Global Heart Foundation Pune on Google, you will get our numbers. You can reach out to us over there, and you can share our reports. The email consultation, because it's a trust, the email consultation is absolutely free of cost. We do not charge patients on email. If you need to converse with the doctor, then in that case, there is a charge of 250 rupees. And we can also organize a video or a telephonic conversation now. Consultation now. So you sitting at your home, you can just find out, and you've already shared your reports with us. We have our team go through everything. So when we meet you on the call, we are already prepared. It's not like giving through the report. And that's how you can actually take control of the situation, by using ECP and myodrops. But I have to tell you, Bhushan, that while we are absolutely happy that we could have, ECP or myo could be the right choice for you, there might be also a small window that we may not be able to help you, depending on your situation. Right now, I don't know. And
depending on the reports.
Yeah, and my doctors will assess the situation from a medical standpoint just to make sure that whatever I've said is applicable to.
Yes.
But in my experience, from whatever you're asking, ECP and Myo should be easily accessible to you to take care of your situation.
Wonderful, wonderful. We have another question here from Betsy, who says, what treatment is available for block in artery in leg? Angiography shows block of 70% causing severe leg pain. Is this something that can also be addressed with ECP?
So to answer that question, we have had patients who have had a blockage in the carotid arteries, femoral arteries, etc., etc. So we've had patients. Now, I have to be honest with you that myodrops has not been studied to for the other parts of the body, but this is an absolute. This is not a professional opinion, but this is a very personal opinion that blockages are pretty much they do differ in some way, but they're pretty much the same throughout the body, the way they are formed. And the fact of the matter is we've got blockages in our entire body. We've got some sort of blockages that keep getting formed, but the problem is when it comes in the heart, right? So when you consume a drug like myodrops, it's not specific target to
just the heart.
So it works on it mixes in your bloodstream and it works on your entire body. So we might be able to help you that way.
Yeah, with
myodrops might be able to help you that way.
Okay, great. Yes. So before also, it would be interesting to share now that the reason we are also having this webinar is to create awareness about an upcoming camp, which will be held in Goa, right, by Global Heart Foundation. So maybe we could speak a little bit about that, and that way maybe Betsy, Bhushan, those who are here and are really serious in taking this forward can prepare to come to the camp and avail of some of the services directly. So would you like to share a little bit, Sujal, about the camp that's supposed to be held in Goa in April?
Yes, so we are coming to Goa. We are traveling in and around Goa. We're going to be in Karwar, and then we're going to be in Goa, and we're just doing the whole camp system, which is happening in Goa on 5th of April, 5th and 6th of April. And we are going to be at the International Center in Panjim. And that's where we are going to conduct the camp. So we are going to we usually start early in the morning because, like I said, most of the patients have to come fasting. So the camp starts at about 6 a.m. So you can connect with us. We have your contact as well. You can connect with us directly. Tell us that you're interested in getting a scan done. So what happens and why this camp could be exciting for you is number one, you can come and meet us. No problem. You can just come and meet us. No need to do the scan. Okay. This is not like you have to meet us. And by the way, if you come at a camp, all your consultation is free. We don't charge. We don't charge patients at all for consultation on a camp. Just come with your reports, come meet us, see how you feel, talk to us.
Get an opinion.
Get an opinion, exactly. Yeah. That's the thing. Just find out what your options are. Exactly. Don't get cornered into your options. It absolutely does not matter if you choose not to do the scan. That's where our 50% of our job, as Global Heart Foundation is to educate the patients. So it does not matter if you do the scan. If you can just come, share the reports. Our doctors are there. Hopefully this time around, I'm also planning to travel with some of our teammates, and just because this time around it's going to be, we are expecting a lot of response from a lot of other cities as well. I just love meeting everybody. So I might be around myself. So we can all speak about it. The scan, if you choose to do the scan, will take 20 to 30 minutes. You'll need to get in touch with us. We'll tell you what time slot you're coming, because usually camps can get pretty crowded. So if you don't want to get waiting, so we always have a schedule, not only in camps but also at our Pune center. Everything works only on appointments, so that we try and reduce the wait time of patients. It's just not fair to get a patient who's already ridden with troubles to make him or her wait endlessly in the reception. So you need to get an appointment. Once you get that appointment, you can come for a scan. The scan will take 20 to 30 minutes. We'll give you the report right there and then. The report, the scan costs you 3,600 rupees.
For the entire scan and
For
the
the
report,
entire scan,
right?
the report, the consultation, everything put together, cost you 3,600 rupees. You can come, get the scan, speak to us, see what you feel about it, tell us about your problems, and we'll see if we can. One of the reasons why Global Heart Foundation does absolutely well, and we don't market really ourselves, but our highest way of reaching people is through word of mouth, and that's because we also tell a maximum number of people that no, we cannot help you. So we will not unnecessarily push you into getting anything done. We are extremely proud of that. So I just thought that
That's wonderful. Yeah, transparent, right? Yeah.
Yeah, if it can't be done, it can't be done. If you ask us, we'll point you in the right direction. We will not recommend you because we don't work on any sort of recommendations. Once you come and get the scan, then you can choose to opt for any of our treatment if you want, either Mayo at your own location, or you can choose to come to Pune for ECP if you really feel the need, or if we feel that yes, you are a suitable candidate. And more importantly, we never thought, but one of the side benefits of doing the scan is that, over a period of time in other cities now, they've actually made a community, because wherever we keep going, this is, we used to come to Goa a whole lot before, very many years ago, and we've decided to, kickstart this again around the plan before around the pandemic, but of course now we're coming back in full swing. So we used to come to Goa. It becomes a full community that, because we visit the city once every 6 months or so. So everyone knows that Global's coming. You meet other heart patients. You get to discuss with them. How are you feeling? Is my drops helping you?
What's working
Is it
for
not
you?
helping you? And we encourage that. We encourage that. It's fantastic.
To learn from each other's experiences.
So it's just a brilliant thing. This camp is quite nice. A lot, because I'll tell you what. Only another heart patient will first realize the problems of the heart patient.
Yeah, that's true.
It's very difficult for the family also to understand, but the other heart patient in a jiffy will tell you, okay, yeah, you're absolutely right. This is exactly what happens to me.
Yeah, so true. Yeah, wonderful. So this is a great opportunity for all of you in Goa. Please do, share the word, spread the word, and the information regarding the camp, where to register, where to make an appointment, where you need to come, will be shared with you. We have your numbers, we have your email address, so we will be sharing that with you as well. Do request that you spread the word as much as possible. That being said, at the camp, you have two options. One option is to just come in with your reports, as Sujal shared, and get a free consultation. And you have the other option of getting also a scan, right, Sujal, which will be paid. So you can still just come in and have a feel of the place and get to meet some of the doctors that will be there, right, Sujal?
Yeah, absolutely. The other team members, doctors, and hopefully me and some other of my colleagues will also
team members will be there. Wonderful. Okay, Sujal, we do have two more questions, and I think they are really good questions, so we can take them. Sai says, I have done bypass surgery 6 years back. Now again, I'm getting some chest pain in the chest area. Is there treatment for me? And my age is 34.
Absolutely. So I would say that this one of the benefits that you have is, though you've undergone a bypass, it's absolutely great that you have age on your side. So we can definitely try and see if Maya drops or ECP will help you. You can very quickly send us the reports at doctors.ghf@gmail.com, or you can just Google us and you'll have a contact as well. So doctors.ghf@gmail.com. You can send us the reports, or just if you want to get in touch with us even faster, you can call us on our numbers. You can Google us. It's 26165047 or 48 in Pune. I'll repeat that, 26165047 or 48 with the 020 prefix. And definitely, I think if you're getting if your symptoms are coming back, you could share the reports with us. Step one, we could have a look at those reports and tell you if we would like to see you in Goa. We are anyways going to be coming to Goa. You can meet our doctors in person. You can discuss the possibility of how you want to get treated and whether we can help you. Also, you can look at the possibility of getting a scan done if at all you feel that is required, and if at all we can recommend it to you. And once we find out what your symptoms are, find out what your current investigations are. Let's say you don't need a scan, you've probably done another investigation which is recently concluded. In that case, please carry all your reports. That's one thing, that whenever you all are coming for the camps, please make sure you all will carry all your reports. So we would like to speak to you and discuss with you about that. And then at that point in time, we can definitely see if you've already done a bypass and your symptoms are reoccurring, ECP might be an absolutely great avenue for you. And I always tell all the patients who are not sure, if at all there is a patient who the doctor has recommended and said that yes, okay, ECP is a green flag for you. In that case, I always tell them that ECP has zero contraindication. It's an absolutely fantastic treatment.
Safe.
It's a zero contraindication treatment. So at the end of it, the only thing that you will lose, in comparison to whatever trauma you might face, the number one is the ECP treatment costs 75,000 rupees for 35 sessions. By the way, it's the cheapest in the country. Second of all, you will lose the time.
Yeah.
Okay, you will lose that time that you've given. Okay, and while I say that, in the same breath, let me tell you, at Global, we've got a success rate of 8 out of 10 patients in Global Heart Foundation found no need to go back for their surgical option between 1 and 3 years.
Wow. 8 out of 10.
8 out of 10, we've got an excellent efficacy rate that's happening. It's actually my guess is it's sort of creeped over 8 now. We haven't taken a stock of things for a while, but I'm quoting this figure from 3-4 years. So, and we've only grown since then. So I hope that answers her question.
Yes, thank you. And as you said, also Sai can maybe come to the camp, right? So maybe before that, if she gets in touch, may I request someone from your team to put down those numbers and also the doc's email address that you mentioned. So maybe we could have it in the chat.
Sure, can be done. My team's. Thank you.
Yeah, thank you. We have one more question, which is from Elijah. I was diagnosed with a valve leak. Can I do the scan and would myo drops help? I've not done any surgeries before.
No, I would have to say that let's meet on 5th first. And if we feel that you can do the scan, we would like to meet you and see your reports first. Valve related issues is something that we don't really have an expertise over there. But if it's all the same to you, we would really like to meet you on 5th. Don't come in preparation for the scan. Just come and meet us
with your reports,
and then we'll take it from there.
Yes. I'd like to add also, since I know Elijah, he's 24 years old and an athlete. So if we could help him with that. Yeah.
Okay. So Elijah, what I would like you to do is look at an athlete recovery program online. So ECP is extensively used in the US for NBA, the GPA, and another, I think the American Football League. So all their players in their rooms, since you're an athlete, in their rooms, and in fact, we've been trying to make some sort of headway with the IPL. In their rooms, they've got ECP machines.
Yeah.
So athletes actually consume the ECP treatments. Not only that, athletes like Muhammad Ali, he's a big promoter of ECP.
Yeah.
So, I mean, just since you mentioned he's an athlete,
a recovery plan.
Athlete recovery program is conducted in the US using ECP.
Okay. So just research some of that to get some answers. Yeah. And also come to the camp with your reports and you'll be able to get some guidance on what the next steps are. Wonderful. Okay. So I think we have enough, no more questions from the viewers. But just a couple more questions for you, Sujal. Would like to share, I know you mentioned 8 out of 10 patients you have seen have not gone in for surgery or have not had recurring problems. But in your personal experience over the last 20 years, if you had to give us like a ballpark figure with regards to the success rate, what has that been like for you?
Oh, the success rate. So just to put, if we are talking about ballpark, in 2012, our sort of census indicated that we've treated over 30,000 patients.
Wow. Okay. 30,000.
via myodrops, and not, this is not ECP, but this is just simply scanning and myodrops.
Right. Right.
So tons and tons and tons of patients have passed through this treatment, and we have been to sort of to tell you whether we've passed the litmus test on this. I would stick by the 8 or 8.5 mark out of 10, even for all the treatments together, myodrops and both ECP and myodrops. Anywhere between 8 and 8.5 per out of every 10 patients walks out with a very clear improvement.
Yes.
A very clear improvement. Now, what happens is there are a lot of patients whom we are not able to help. I also have to say that in
Honestly,
the same breath,
yes.
that sometimes it's not possible. Sometimes the treatment doesn't work out well for them. Sometimes, very rarely, but there are sometimes that the patient says that there's no difference. So that also happens. But from where I'm standing and from where most of my patients are standing, I think 8 or 8.5 out of 10 is a very, very good average out of any sort of success ratio.
Amazing, amazing. And at this point, Sujal, I think I'd like to share a personal experience, if you'd let me.
Yes, absolutely.
Yeah. Please. Yeah, with everyone that's here. The reason I'm also in touch with Global Heart right now is because my own father, Mr. Orlando Braganza, also from Goa, was diagnosed with 5 critical blocks in his arteries in 2013, and was suggested an immediate bypass. And there was absolutely, as you said, no, the stress that the patient goes through is felt by the entire family. So there was no room given at all for any alternative at the hospital where he was diagnosed. And it was suggested that a stent won't work and nothing will work at this point, but a bypass surgery. So as you can imagine, we had no information whatsoever about any such non-invasive treatments. And we started making preparations and looking up, what are the options for a bypass, a good bypass cardiac surgeon in India, and where we could actually go and do that. And yes, I'd like to share also that my father is someone who would not like anything invasive, because he understands that anything that's invasive would have a longer recovery time, and the impact mentally, psychologically of going through such a surgery was just too much for him to even consider. So in that state, we really started researching and looking up different ideas, different, listening to people, trying to find out what are the alternatives, what is available. And that's when he stumbled in 2014 on Global Heart Foundation. He took time to explore those options, which I'm grateful for. And that's when he reached out, and to his good luck, it was also based in Pune, where the city in which he lives in. So he did visit your organization and meet with you and the doctors, and was the right candidate, like you said. Even though he had 5 blocks, 2 of which were 90% and above, Global Heart did recommend that he does 1 round of EECP, which was 35 sessions. And he was also at the same time given myodrops, which he really, did the entire treatment plan to the T. And just 6 months later, he did a thallium stress test while, after the treatment was complete, and with some changes in his diet and taking care of the psychological aspects. So where he also dealt with stress and things like that, did a lot of yoga, meditation, all of that. And 6 months later, in July, a thallium stress test revealed that his heart was healthy. There was no major damage to his heart, and he was not at risk anymore. So there were no risk factors. And he got that test kind of verified with multiple doctors in India and in the US. And it was just wonderful to have that sort of relief just after 6 months, and without any invasion. So yeah, I mean, personally, I absolutely vouch for the services that Global Heart provides, and I know my father will as well, which is why he's also offered, if anyone wants to speak with him from Goa and get a one-on-one view on his experience, he is more than happy to connect with people and to share his experience and guide them accordingly. Yeah, so I just wanted to share that to also add to the testimony. And yeah, Sujal, so
Absolutely, thank you for sharing that. And he's actually he's like a guardian angel. He's like help us improve our process. We
yes.
take the feedback that we get from our patients very seriously, and he has helped us improve. So thank you for sharing this story. It's absolutely encouraging to listen every time I go through this.
Yeah. Well, thank you, Sujal. I think we've covered a lot of information in this 1 hour. It's exactly been 1 hour. So just one more thing, if anyone is not based in Pune and in Goa and would like to reach out to you, they can reach out to you on the numbers that are given here in the chat and also via email and at the website. Am I correct, Sujal?
Yes, absolutely.
Yeah. Okay.
Can you see the numbers?
Yes,
clearly?
we can see the numbers, we can see the email address, and there's also a website, which is globalheartfoundation.org, right?
Perfect.
Yeah, wonderful. So please, yes. On that note, thank you, Sujal. This was very informative. I think everything that was learned can be shared with others as well to help many more people. Thank you for your time. I know you want to leave us with. Thank you so much. Thank you so much. And we look forward to meeting you in Goa with hopefully some of the participants that are here as well. I
look forward to meeting some or all of you in Goa. I hope I can make it. I'm really looking forward.
Wonderful. Thank you. And on that note, thank you everyone for being here and for giving us this time. We hope this information helps you and your family members, your loved ones, as and when it's required. On that note,
we'll just leave them with a small video.
Yes, we're going to leave you with another small video of another testimony. And yes, look forward to seeing you in person at the camp in April. Thank you, Sujal.
Thank you, everyone, for attending this. Thank you, Sasha, again, and good night, everyone.
Thank you. Good night, everyone. Stay tuned for a short video.
In 2014, I was doing a transition. So we were working on a project. There was almost 17 people we were working together. So I had given, my senior management had given me those tasks to ensure that we transit that particular work and with a smooth run. But during that time, what happened is that I started working extra. So I started spending almost 14-16 hours in office. And that went till 6 to 8 months continuous. And but that particular moment I was smoking as well. So I started smoking almost 1 packet of cigarettes. No food at times, so we used to eat in the cafeteria. So all junk food. We were playing one of the tournaments, one of practice games actually. So at that time I got an indication, but I didn't realize that it is an attack. So my left arm was numb, but I didn't realize that I am getting that because I was very confident that I play regularly. So it will not happen to me. The heart attack can't happen to me because I started sweating and started coughing a lot. But I just neglected it, and it happened that I got a sensation feeling over here in my chest completely, and acid coming out of my mouth and nose and everything. So my chest was burning completely, and all the acid stuffs were coming from my nose and mouth. First of all, told my friends and my brother that if they say operation angioplasty, I said no. First of all, I don't want to do that. So next day the doctor came, the consulting doctor was there. So he said that the ECG and everything normal right now, you are stable. But we will go and do an angiography to check if there are some blockages in your heart. So I did angiography. After doing angiography, they were forcing my dad that there's 2 blockages. One is 80% and one is 60%. They say that we will do angioplasty on the 80% blockage and you will be okay. But I said no. So they took me back to my ward. Then the doctor came and spoke to me. He said that there are 2 blockages and we will put an we will do angioplasty on the 80% now. So I asked him why only 80? Why not 60? So he said that 60 will get cured with the medicine. So I said, then if 60 can get cured, why can't 80 can get cured? So he said, are you joking? It is very serious. So he got wild on me. And the third day, they discharged me, but they wrote a note on the file saying that discharge given against medical advice. So that if I take my file, because after that also I moved around some hospitals and they were very reluctant to treat me because they know that I will not go for an operation. He frightened me. He said that next 15 days, be careful. He just only told me that. So I was very scared. So if I used to go to the bathroom or the toilet as well, I used to take my wife along. I was so scared. But when I came here, after I speak to Mr. Narayan, he counseled me. He counseled me and he brought me out of that. He said, don't worry. Don't worry, you will be out of it. You have to just believe. So as of now, Mr. Deshpande, he had told me that it's okay if you don't take it. But still you want to continue, as a precaution you can just have. So I am taking that.
Thank you, everyone, and see you in Goa.